Yeah. So I think the best way to start would be if you can describe a little bit about what you do at the present.
Okay, so I'm a relationship counsellor and a psychosexual therapist, and I'm also a clinical supervisor. All this means that I work with couples and individuals who present problems with their sexual relationships or just discord in their relationship. And in our profession, our work needs to be supervised by a colleague, which means that you talk about your work with somebody who's qualified to give you, I don't know, maybe some feedback if your work is ethical or if you're stuck and you don't know what to do. It's called clinical supervision. So I do that for Relate London, North West and Hertfordshire. And I also teach there. Workshop for relationship counsellors, because not all relationship counsellors are psychosexual therapists. And I have a private practice here in central London and in North Finchley.
Jesus, you are very busy. So how does it work? So for the person who, for example, is a counsellor, they need to be supervised. At what point they stop needing that supervision? Okay. So even in your private practice, you still...
Yes, if I'm also supervised by somebody else.
All right.
When you're a counsellor, this is a requirement, and you're registered and accredited with certain professional bodies. It's a part of your job. You don't just see clients, you also talk about your work with somebody who is trained to listen to you as a therapist about your work.
All right. And do they sit on the sessions with the client? Okay. No. So it's kind of...
So it depends on what you do. If you see psychosexual work, you need to have 1 hour of clinical supervision for 6 hours of your client work. If you're training, because I see a lot of trainings as well. And if you do relationship counselling work, you need, depending on how many hours of clients you see, but minimum of an hour. So you need to spend, it's like a session with a therapist where the therapist will be telling me how he or she is affected by the work or stuff like that.
All right, fair enough, I see. And you mentioned obviously the difference between a psychosexual therapist and a relationship counsellor. What's the main kind of differences between the two?
So it's mainly, well, the way I understand the difference between counselling and therapy per se, it's therapy is focusing on treating something when there is a problem. So in psychosexual therapy, people come with a specific medical condition, which could be problems with erection, ejaculation, problems with orgasm, or very, very often is loss of desire. And there is a framework on how we do this work, and there are some behavioural tasks that they need to do. In counselling, not that you come with a specific diagnosed difficulty, for example, like depression or anxiety, or you could be totally healthy, mentally healthy, but you have discord in your relationship, or you're lonely, or you just broke up with someone and you need to process all these difficult feelings. Or every couple has a challenge, and you can get stuck and have the same argument over and over again.
Yeah.
And this is a place to come and work with that. So it's not nobody that there isn't particularly a problem as such as could be diagnosed.
Okay, I see.
But there are difficult feelings that need to be processed.
So it's more general sort of conversation, whereas the therapy is more of a medical approach.
It's both.
Yeah.
It's both. You can't separate sex and relationship because it's in sex is relational. So you still have to do both. Yeah.
Oh, complicated, but so interesting. And how did you end up in that field?
Right, so my first training in the counselling field was in 2006. So I trained with Tavistock Centre for Couple Relationships. So it's a very old classical training, psychodynamically. I did 1 year of it, and I wanted to do something more integrative because there are various different counselling approaches, and if you go into all these counselling websites or directories, there will be humanistic and psychodynamic and systemic, and all these people don't know what it means. So basically, to work with a relationship or with a couple, I thought it would be better to be trained in various approaches because if you only have a hammer, then everything looks like a nail, as if you do. And so that took a while. So at the time there was an integrative course that trained in various approaches. So I did masters with in relational counselling. But then when I started working as a practitioner, I realised I don't have enough knowledge when people come with sexual issues. I simply don't know what to say sometimes. So, and they don't pay enough attention to that. 3 years of training, and that really vague papers about sex. So I've done another 2 years of training in sexual diploma, so to understand how to work with that. And it is quite different training from relational training. Yeah. And then if you have all that experience, I was just offered to do by my organisation to do training and supervision, so I can help, their centre supervise other counsellors' work.
Fair enough. And how do you start your own practice? Like, what is kind of the way for you to become an independent? Yeah.
Okay. I recently started that because I was doing quite a lot, and I was training a lot. I took a medical degree by now. I spent 7 years doing different trainings to do what I do now. So I was focusing on that, and I really like working with an organisation because you have colleagues. When you work privately, it's just you. But I've been with them for 10 years now, and I feel like I need a new challenge. And working privately it's different. It's how you screen clients, how you do assessments. How it's more like having a business. So I've recently started doing that, and I'm quite excited because it's quite different than working for an organisation.
And you said screening clients. Are there times when you decide you don't want to work with certain clients?
No, it's not that I don't want to work with certain clients. I think that people are very complex, and there are some issues that simply there are people who have specific training. For example, if somebody comes with obsessive compulsive disorder or with severe depression or with drug addiction or alcohol abuse, I have a general knowledge about that. I can work with the impact of these things on relationships.
Okay.
But I'm not trained to work with an individual who suffers from severe depression. So counselling is a very broad, and you have specific, we call it specialisms. So my specialism is focusing on relationship and sex. So I do refer clients to other practitioners or to other clinics.
Okay, makes sense. Yeah, so you just specialize in one thing, and hence you can fix something that you don't know in-depth knowledge about it. Fair enough. You said that with psychosexual therapy, that the majority of people that come through is about loss of desire. How does that? So, my question is reconciling in my head, because I have certain people I know which have been in relationships for, say, 35 years together. And it's a mind-boggling figure for me. It's like, it's a lifetime you spend with that one person. How do you manage to keep the relationship together for so long? How does it work? How do people...
Did you ask these people?
Well, they give generic answers with regards to just, or we just fit well together, or we listen to each other, and you're like, fair enough. But in the end of the day, especially when it comes to sex and relationships, in 35 years, you most likely have tried everything and anything that is out there, if you would. So you would just get bored of that one person because you've seen everything that you could have seen. So how do people reconcile
I don't know
that?
how people do that, to be honest, because everyone is quite different. I only see people who have problems, right? Who come to relationship counselling, and they will be presenting some social issue. However, it doesn't mean that relationship is bad, yes? And it's actually a lot more people realise that you can get help with when they feel stuck, because you have quite a lot of education in school, growing up about everything, about algebra, physics, geology. How often do you use that in life when you grow up? Covering all these studies. But there's nothing about what to do in relationships, how to argue, how to disagree, how to, communicate. There's very little. Now these days they start doing sexual education and communication skills, but it's more from a reproductive point of view, consent, and what you do in relationship is still what do you do? As you ask, what do people do to stay for so long? So I think it's when people come to sexual therapy, the loss of desire, it's usually for couples who get on well. Yes. If they get on well and there is something, and they have respectful and loving relationship, but there is something that is blocking their physical intimacy, then we need to understand what it is. And it's different for different people. So we do a very thorough assessment with each partner individually to understand what actually is the problem, what triggered it in a relationship, and what made someone vulnerable to experience this particular problem, and what in a way they both do to maintain it. Right? So we're talking about how people learned about sex, how they had their expectations, right?
Yeah.
What partners you had, if you had a previous partner, what happens during sex, who initiates, parents, family, religion, culture, country. All these have quite a huge impact on how you perceive sex and think what's normal and what's not. So we need to understand that. And as I said, there's very little information on what is sex like in long-term relationships. So where do you get that from? And it's movies, porn, friends, and that's all either staged or made up, or somebody's. So it's quite, and it is exploring with. So if there is, mainly the loss of desire will be present in all cases with sex, because if there are physical issues, then, and sex wasn't happening the way people wanted to, then there will be anxiety already. People are worried about losing erection, ejaculation, women, or if they have pain, they just silently suffer and don't tell anyone for a long time because you don't know how to talk about these things. Or simply, very simply, because when people date and it's seducing someone, so they spend more time on showering and getting dressed and thinking to do interesting things, and they have sex in their mind. And when you live together, you could be having a very difficult day at work. You didn't sleep well. I don't know, you came and have a couple of drinks and then you want to go to sleep, and your partner wants to have sex with you, and you're wearing pajamas. So that's not exactly the same context. And if it's experienced as a rejection, then all this tension starts. So it's about what is the right context for both people to be sexual, because you will never be in a relationship, very rarely in a long-term relationship, to be aroused at the same time suddenly, so you need to create that space. Does this make sense so far?
Yeah, it does.
Yeah. So and if it became an issue, as I said, people start worrying about it, and the more you worry and the more there's pressure, then the desire will not come. And there is a huge difference between desire and arousal. So desire is it's a subjective, it's a wish to do something. Right? So you want to have sex with. But arousal, it's a physical response. So the blood flows to the genitals, your heart starts beating faster, all these sorts of physiological changes in your body. And they're not always together. For example, you may love your partner and you see that they are beautiful or handsome and attractive, but you're tired, so you look at them, but your body does nothing. Okay? Or if sometimes when there's a lot of stress and people are raped, they can get aroused, not because they like it, but because body responds with arousal, so there will be less tears. Yes, so with lubrication and the vagina. Or there are spontaneous erection for boys in school. Yeah, who knows that?
Been there.
Yeah. So it has nothing to do. So desire and arousal ideally should be together, but they not always are. And there's quite a lot of misunderstanding in couples. Oh, if you don't want to have sex with me, then it means you don't love me anymore, or you don't find me attractive, and all these things start. it's because people don't know what to expect from their bodies and how their arousal and desire works.
Okay.
And also with age, bodies change. So somehow people imagine that sex should be the same when you're 16 and when you're 66, but it's not exactly going to happen because the body's changing. The skin is loose, they're looser, and all it doesn't mean that sex is less enjoyable, but if your expectations don't match, there's a lot of anxiety. So when the mind has to choose between arousal or desire and anxiety, it will always choose anxiety.
Oh.
That's because it's a threat, and you need to survive. So you always go there.
Interesting.
And if people feel anxious about sex, then they're not going to enjoy it.
Makes sense.
And it gets to the point of losing complete, interest.
Interesting. It's so bizarre that we are not taught the endless, basically, dimensions of personality of people and how to manage certain things, especially in relationships. For example, I've been in a relationship once. We've been together for about 3 years, lived together as well. And what happened was the desire just went away at some point, and it just was that, and still you're in those caring relationships, but the desire is just no longer there. In your experience, is it more that couples come to you or individual people with that problem and then they bring the couples together to have a conversation?
It works better when you have two people in the room because loss of desire always relational. If you're on your own, it's not really a problem, is it? So it's only a problem when it's. In a couple, there will always be one person who wants to be sexual more than the other.
Yes.
Because, as I say, it's not, and it's how you manage it. It's like you manage any difference. So if you come on your own, and you are in a relationship, I will advise to bring a partner. If relationship is people argue a lot and it's quite resentful, it's not going to work with sexual stuff. You need to do some relationship counseling first, usually. But it works best with a partner because it affects both people, and usually it's shared, which I mean that, as I said, one partner take more of the role of initiating, and the other always says no. But it happens a lot that when the partner who is less sexual becomes more sexual, the other one goes, "Oh, I'm too tired." So it's not one person's problem, and also it changes. The context changes when you didn't live together, you moved in together. Yes, so there's a change. Children, you're not just partners now, you're also parents. It's how you perceive your wife, mother of your children, to have sex with rather than just a girlfriend. So there are all these invisible messages that dictate people when they can be sexual and when they're not. So some people are a lot more comfortable and they enjoy sex with strangers, and they love their partner but they don't feel any arousal or desire. That's not unusual. Or the other way around, they feel terrified of strangers or starting a new relationship, but when they're already in a relationship they feel quite comfortable. So everyone is different.
You said that you can love the person but have no desire or interest in having sex with them. How do you fix that?
Would be very personal for everyone, but why?
Sorry.
Let me just think. So it depends. That there's many layers, and we will be exploring why. And the reason I won't be bringing particular cases because when people come and see me, this is I promise confidentiality. So I won't be quoting a specific case.
Makes sense, yeah.
Right. So it could be that religion was important for the family, but it wasn't important for this person. So if you say 100 times, "I'm not a Catholic," but you have a family who is really religious and went to church, and in Sunday school children were taught that you go blind if you masturbate, and sex before marriage is bad, and all these things, even if you don't agree with them, they are there, on the background somewhere. If there's a huge split everywhere, if you look at the culture, all religions, so you have a whore and then you have a mother. So you don't have sexy mothers, doesn't look and doesn't even sound right. So it's about also that a role of a woman, or if there could be various reasons. It could be that. So let me say this: if the sexual difficulties, it could be in DSM is American diagnostic tool. So in order to be called a dysfunction, I don't like the word dysfunction because it kind of points to deficits, but usually these problems, they have a very good function. So it doesn't mean that there's something wrong with you at all. It just means that your body and your mind adapted to a particular situation that doesn't help you anymore. Yes? Does it make sense? So it could be lifelong, that you've always experienced this. Yeah, so we're talking about pain during sex, or losing interest after having sex once with your partner, yes, or erection ejaculation problems. It could be situational, that it could be that it started happening after a certain event, so it's acquired. Yes? Okay. So you were fine till a certain point, and then something happened. You might not even notice, but we need to just, to kind of find out what happened. That it changed. It could be loss of desire that is total, and people have no sexual dreams, no sexual fantasies. They're not interested in anything or anybody. Or it could be that they lose desire in the relationship, but they're interested with other people. They have interest for other people. So that's situational. Same with men with erections. So they cannot get aroused with their wife, but if they watch porn, for example, they can. Okay. So it's total or situational, and it depends, because it's body and mind. Yes, because the most important sex organ would be brain. So you can have orgasms when you sleep, for example, and arousal. Yeah. Orgasm while you sleep. Yeah. Awesome. Didn't know. Well, the boys, the wet dreams. What is that? That's ejaculation. You might not remember it, but it does happen. So what was talking about? Okay, so that's why it's difficult to say. We need when people come, we have to rule out all medical conditions, because if there is a problem with hormonal balance, no matter how much sex therapy you do, something to help, so we need to figure that one out. The first sign of heart problems, blood pressure, diabetes, and cholesterol will impact the blood circulation, which means arousal, erections, or lubrication for women, and also orgasm. So there are certain tests that people need to do. I'll tell them what to do, what to say to the GP, especially when there is pain, before they start. So we know the body is working fine, and these issues are psychological. Okay. If there are medical issues, then the help of medication might help. Or there are some physiotherapy, which I suggest clients do when there are usually problems with pain or erection ejaculation. There's physiotherapy that they need to do. So it's a combination of talking, exploring sort of how did your ideas around sex, how they become the way they are today, physical condition, relationship, quality of the relationship. And there is a ban in sex and sex therapy for a long time. Is there what? Ban, no sex in sex therapy for a long time, because if it causes problems, then we need to change what happens. It's literally rewire your entire brain about how your body responds to touch. So there's a lot of contact. Yeah, there is a lot of contact. There is a lot of touch, but there is no pressure to be aroused. There's no pressure to basically to do sexual things until you teach your body that it's safe to be touched. You're not under pressure. You don't need to feel something that you're not ready to feel. Okay, so you basically don't have sex while you're in that therapy until the therapist. You don't have. Is the idea, the rationale behind it. So the first people who studied sexual response were Masters and Johnson. I don't know if you've heard of. So where were we? Well, we're talking about the fact that there's a ban during the therapy. Yes, because there are also different types of desire. So what people normally think when someone says desire is when you look at your partner and you feel arousal, right? So that's called spontaneous desire. So you're not touched. You thought of something sexual, or you saw somebody, and your body starts responding with arousal. And there is responsive desire when you are not thinking about sex, but you know that, and you don't feel any arousal in your body, but you know if you start being touched or spend time with your partner, you will get aroused, you will get desire.
Yeah.
Right. So it's called responsive. And so there's a lot of pressure for people that if the partner initiates sex and they immediately not aroused, you start worrying, oh, what's happening with me? Why am I not aroused? And again, anxiety starts, so you can't get aroused. So yes, you need to have a context where you feel that it's okay if you're not aroused. You may or may not have sex, but you have some physical intimacy, and if you don't feel pressure, that immediately it will be all right. So Masters and Johnson in the 60s, they started researching the sexual response, and I think they already had spaceships flying, in the 60s, but they still didn't know what happens during orgasm, physically. So they were doing that research, and they focused mainly on physical responses, and they broke down into 4 categories. So they were researching healthy people who would come and basically masturbate in the lab, and they were monitoring their physical responses during sex. So they saw 4 distinct phases. So there would be excitement, where the arousal may come and go. Then it would be plateau, when it's a maximum of arousal, which means that all your body is tense, maximum erection or maximum lubrication, and widening of the vaginal walls for the women. And then it's released through orgasm, which is really, really short, a couple of seconds, with contractions of various muscles in the body. And then there is resolution, when the muscles return back to normal. So they notice that. But they spend not much time on looking on desire. So psychosexual therapy, the way it's taught, is still, like it's 1960s, is looking into very medical model. But then when people come with desire, and it works really well. It works really well because there are the set of exercises that they call sensate, where you ban sex and then gradually you increase what people do, where they can touch, and it works really well. However, with people with a loss of desire, you can't start straight with sensate model, because there's so much anxiety and there's so much insecurity about what's happened that it just makes them more anxious. So we usually start with more of a sort of conversations of different types of exercises before we introduce sensate. Does that make sense?
It's so weird. Why is it the case that we live in such a, well, at least technologically advanced world, which is basically the future as far as I can see, but we're still on many psychological educational side of things, we're so far back behind. What is it that's not allowing us to progress?
I have no idea what is not allowing us, but the information is there. And actually, I have my clients who are doctors, MDs, and I talk to them because they have psychological degrees, they have medical degrees, and when I talk to them about the sexual response, they don't really cover it in England, at least. Yes,
Interesting.
Yes, and so I don't know why. There is this myth that people are a lot more sexually open in advance, but I don't think it's true.
In advance?
And like if you compare our society now and in 1800s in Victorian England, but if we just have more porn, yes, and it's not actually an advantage, because the expectation of what sex should be like is completely
wrong. Yeah.
Yes, so and young people start watching it really early because it's accessible. And it's not that it's wrong watching porn, that's not from that perspective, but if it becomes a habit, it's very difficult for young people to have partner sex
Mm-hmm.
because you think about desire and arousal, as we talked about.
Mm-hmm.
So you train your mind to be aroused looking at the pictures.
Mm-hmm.
And so your arousal works when you're on your own, it's safe, no smells, no liquids, no exchange of fluids. Yeah?
Interesting.
Nobody's watching you, you can do whatever you like,
Mm-hmm.
and you orgasm. You know
Mm-hmm.
your body really well, yes, you orgasm. Then you go with a partner,
Mm-hmm.
and there is all this mess and bumping, right? And you worry about all this stuff. And then I work with young people who are in their early 20s and they started watching porn when they're 13, so they have 10 years of training their bodies to orgasm to porn.
Mm-hmm.
So they can't orgasm with a partner.
Mm-hmm.
Because a woman's vagina and a man and your own hand, very different things. So they don't get enough stimulation through penetrative sex. And it appears as if they lose an erection, but they don't lose erection, they just don't have enough stimulation for orgasm through vaginal sex. And that's porn. That's masturbating for years and years and years watching porn. So if they put it that way, I think a lot of people would be more cautious.
Holy I'm sorry, wow. That makes so much sense.
Yeah, so you basically condition yourself, like Pavlov's dogs.
Yeah, exactly right. That's what I was thinking. Because I had a problem in my day, or not too long ago, where it was like, you know, porn was a defaulted thing to do. And I had a girlfriend, but it's like, yeah, but this is kind of more interesting. And then I realized at some point it was just like, I have a girlfriend here, which is great, and I don't have sex with her because I want to go and watch porn. Something is not right there. So I kind of limited myself from porn completely, just cut it off, stopped watching it for about now. It's been almost a year. And it's a dramatic improvement in my, obviously, desire, first of all, for my partner, and the feeling during sex, because the first couple of months, sex was just not that good because I'm used to this mighty thing. It's insane.
Yeah, if you think that in order to enjoy something, you need to be quite present. So if you're watching, I don't know, a movie and your mind is somewhere else, you don't know what's happening. So we trained like that academically. So if you're in school or if you're in the lecture, if you start thinking about shopping list, you fail. But if people are healthy, you don't think about your body very much. Yeah? So you're pretty much numb unless something hurts. So in order to enjoyable sexual experience when people are present, actually not thinking, is this going to happen? Am I aroused? Am I not aroused? Am I degeneration? But when actually enjoying the feeling.
Yeah.
So the sexual therapy focuses on that, and the exercises in the beginning is actually to connect to your body more. So you do it individually and you do it with a partner. And you've got to practice mindfulness. Well, what I mean by that is that when we talk now, you are not aware of how your toes feel, right? Or how your back feels. The minute I mention these words, your mind goes and automatically checks them out. I didn't tell you, please check your toes. I just mentioned that. So it's focusing your attention where you want it to be. And because we do psychosexual therapy, we focus attention on the body. So, because if there are anxiety about something, so we need to also explore with people what happens for them when there is a sexual situation, what they're thinking, what they're feeling, how their body responds on a physical level, and what do they do, what is their behavior. And usually the thoughts are, oh my God, I'm not aroused, or I'm going to disappoint him, or I'm not sure if she's enjoying this. So it's not particularly sexy thinking, is it?
Yeah.
And they feel anxiety or tension or sweating or doing all this shaking. And what we need to do is, you can't block these thoughts, right? The more you try to block a thought, the more it persists. So we can refocus it, and that's why there is a balanced sex therapy. So there's not going to be sex, right? Fine. So you don't need to worry about being aroused. So you can focus on the touch without feeling pressure, and sort of explore what is it like when your partner is touching your hand. Do these thoughts still come, or can you focus on the physical sensation? So the idea is, if you totally relax, and I'm talking about long-term relationships, if you're totally relaxed with your partner and you feel safe, the body is body. If it's touched in a particular way, then you will respond with arousal. But in the beginning, there is touch. There are exercises. When people are fully clothed, then they remove their clothes, they stay in their underwear, then they take their underwear off, then they don't touch genitals, then they do touch genitals. So it's very, very slow progress, because you can't change it in it. It's logically, you can understand that. Intellectually, you can understand that. But body keeps the score. There's a very beautiful, but the body remembers. So if sex was stressful, the minute there is anything that reminds you of the former situation, you will respond with anxiety. But so the work is, it's not going to happen. They're very firm boundaries. You should focus on your sensations. And you need to do it on your own, and the way it looks, rather than taking a shower and thinking about the day, because that's what many people do. Sometimes you don't know if you wash your hair, if you, what happens to it kind of, it's focusing on how you wash your hair. It's focusing where your fingers are, how the shampoo smells. So the work sensate is working with your senses. It's actually connecting to your senses, and it sounds easier than you should do it, because your mind wanders in a few seconds. And the exercise is to bring the mind back to the physical sensation.
Okay.
And it's, for some people it's easier than others, but you do it on your own, and then you do it with your partner. And so that's one type of exercises where you focus and notice how your body responds. Okay,
yeah, I think I understood it. Yeah, you're focusing on the present feeling rather than thinking about
what should be happening.
Yeah, because as soon as you said then you do it with your partner, I was like, yeah, because if you do it with your partner, you start thinking, I was like, does that look good? Blah 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 blah. Wonders, but you want to bring it back.
So it's not. It's these are the exercises. It is the bridge between, if people come unhappy about their sexual relationship, it's a bridge between what happened and what they want to be, because you need to understand what they want. Yes, and it is these mindfulness exercises with partners. It's not to please anybody. It's sort of focusing. So when you are being touched, is what happens to me. And what's my mind doing? And it could be you're falling asleep, or I want him to touch there, not there. Your mind will be predicting and controlling stuff. Yes, rather than focusing on how it actually feels. Yes. Or does she like it? Does she like it? So it's actually not to please someone. It's focusing on what on your hands when you touch your partner. Does it make sense? So you kind of practice that skill. And first 3-4 months are around that. And when you cover it, because you're literally rewiring your brain on how you respond to touch. And it works really well with couples. So it doesn't work when there is a severe mental health issues and they're not being addressed. Yes, so if there's obsessive compulsive disorder, this is going to be really difficult. And if there's no medication or support, it's not going to work. Pregnancy, when women get pregnant during this, is body changes every week. It's no longer priority. Okay. Medical treatment, cancer treatment and stuff, because people just get very tired and ill, and it's not going to work. And addictions, sometimes, if people are getting help for their addictions, that's fine. If addictions were not disclosed and it goes into porn use or multiple affairs or seeing, and they haven't talked about it, it's definitely not going to work, and eventually it's going to erupt. And it did happen a few times because it's such an intense work. And you're working also not just with your body or your mind, but you're working with how your intimate connections, emotional intimate connections. And when people have addiction is, or compulsive behavior, it's sort of a bubble where you keep yourself distracted from everything else. And it sort of, if it works, it depends how it affects your life and relationships, which means you need to get closer to your partner, emotionally and physically, and it's too hard if you have that going on.
Makes sense, yeah.
Does it make sense?
Yeah, this is mind-boggling how much things we don't. Wow. Okay. There's just a whole world out there of people who just don't talk about this thing at all.
Another thing that is not talked about is sexual abuse.
Yeah.
True. UK statistics show that 1 in 4 women and 1 in 6 men have experienced some sort of sexual molestation and abuse.
Wow.
Yeah. And it could be growing up as children, or it could be where people are older, in university, and it could be anything from exhibitions flashing at kids, or it could be abuse in the family, or in school, or it could be rape. All these, they happen very, very often. Wow. And there are many people who are in relationships and that's more women actually than men, that they feel they have to give sex to their partner, or they have to be available sexually, and they don't want to do it, and they put themselves through having sex, and actually they're coerced into having sex. With that, people, any kind of abuse makes people feel worthless, and it's not their choice to be sexual, and there's a loss of control. So coming to sex therapy, when somebody's telling you what to do with your body, is very hard. So there's an extra layer of how we work with people who experience sexual abuse, who they were coerced to have sex in a relationship, and also people who felt out of control of their bodies, not because of abuse, but because of, let's say, medical circumstances, like traumatic deliveries and labours for women. So we do what I call consent exercises. There is an American biodynamic body therapist, Betty Martin. So she talks about 3-minute games, I think she calls them. Anyway, so this is a consent exercises where people touch each other because they agree to. I know it sounds very simple, but it's very important for the mind, because the awkwardness in sex comes when it's not clear who is it for. For example, if you think you're giving your partner pleasure, but your partner does not experience any pleasure, she's not receiving anything, she's allowing this to happen, which puts you in a place of somebody would take something from her. Does it make sense? Yeah. So it's, who is this for? And maybe an example would be, if you go for a massage, so it's very clear, this is a masseuse, he's there to give you a massage and you're there to receive a massage, right? So it's touching you on the back and everything, and then if you feel that something is changing, or you're being touched up a little bit, or his breathing is changing, even if it's for 2 seconds, the dynamic of how you feel changes, because he's not giving you anything anymore. He's taking something from you, and you're lying there and wondering, did this just happen? I'm not sure if it happened. Yes, so you're allowing this to continue, and you feel awful. Does it? Yeah. That happens a lot. So if you're being with a partner who insisted on you having sex, and now you're in a new relationship, and your partner's trying to arouse you, your mind just no, and you don't stop. You say, you know what, I just need a break now. You're not giving any pleasure. You're just putting your partner in a position where they allow this to happen, put you in the place of an abuser, right? So there are exercises to counteract that, to be touched exactly how you want to be touched, and it's very healing for people to do that. Yes. Makes sense, yeah, because that restores kind of the. That restores that you're in control of your body, and this is completely different context. This is a completely different partner. You agree to do this. You want to do this. So you're teaching the mind and the body that it's safe to be touched. On this topic, it's interesting. If a person doesn't say no explicitly to you, how do you supposed to know that? You can't read minds. So it's not kind of your fault if that happens.
in a certain way.
If somebody, if you don't,
for example, let's make it simple in terms of you're in a relationship with a girlfriend, right? And you kind of want to have sex, and she's kind of okay with it. You know, well, there's no clear signs that she says no, and you have sex, and then maybe during sex, in her brain, something changes. She's like, I don't want this anymore, but she allows it to happen. But you kind of feel the dynamic somewhat changes because you can see she's a bit bored, and then you kind of finish up and that's it, and then she's not too kind of happy about it because she didn't finish because her mind wandered off or whatever. Does that put you in a position of an abuser then?
No, I mean, I don't want to generalize as well.
Yeah.
And the best way is to have a conversation. I noticed something.
Okay, so it's as simple as okay.
And it could be that I don't know, she had gas, you know, and she wasn't ashamed to tell you. Okay, or she needed to go to the loo or something. It could be something completely minor. It doesn't
makes sense, yeah.
But if it happens over and over and over and over and over again, yes. So it's not anybody's fault. So it's not looking at the perspective you're doing something wrong.
Okay, I understood.
Yes?
Yeah.
Absolutely not. If you have a respectful relationship and this is awkward dynamic, you don't understand why it's there. It's not because you're doing something wrong. It's because there's lack of language on how to communicate about it.
Okay.
Yes.
Makes sense. Okay. Understood.
And
yeah.
Partners usually why they don't want to hurt your feelings, and you know it's because you want your girlfriend to feel good, and you try, and so it's not his fault. No.
Okay.
They usually do their best in a relationship.
Silly that sounds, like trying to do your best, but yeah, I understand.
Yeah, but they do. It's just miscommunication.
All right. In relationships with, for example, if your partner or you don't want to have sex at this particular moment, how do you communicate that to your partner so that they don't take it as a outright rejection?
What do you call sex?
Well, I would go anything that is to do with genitals. So if you go oral or whichever, maybe.
Touch. So, and how would you start it?
Well, for example.
Okay, my point is, would you go straight for genitals? Usually, I mean, it depends on the situation.
Depends on the situation, yeah.
So it depends on the context. It depends on your partner, and you know your partner best. And again, these are the conversations that people don't really have.
True.
Because you could be, and as I said, it could be that it's totally fine because your partner will get aroused later.
Yeah, because it's
responsive desire.
Yeah.
Or your partner could say, you know, I enjoy the touch, but when I want to sleep like in 5 minutes, so let's not take it all the way.
Okay.
So it's how you talk about it and what it means to you and for her, because if it's not said, it could feel like a rejection. It could feel like, you know, lack of interest.
Okay, so it's just about the communication and just saying how you feel basically in that moment. Okay. Is masturbating fine in relationship? Like, is that a normal thing for people to do? Because, well, for me, I'm a bit on the fence about it because of my history with it. So I would say I wouldn't want to go down that road. But for other people, I hear they say, well, it's not a problem.
Yes, of course it's fine, but it depends also on how it impacts you in your relationship. It's like, is drinking wine fine?
Oh.
Yes.
Okay.
But if you drink every day a bottle, yes, that's not okay anymore, because your whole body changes when you load yourself with this much. So the same with everything, with masturbation as well. If it doesn't impact your relationships, and it's okay, because your partner, you know, people say sex drive, right? So there is no sex drive, really. I mean, it's an old term that Freud still uses, but drive equals survival. So it's an uncomfortable feeling that drives people towards survival, like hunger. So you don't eat, you die. You don't breathe, you die. You don't sleep, you die. You don't drink water, you die. You don't have sex, you don't die. Yes? Once or twice. We're talking about the whole human race. It's something else, but individually you will not die from not having sex. So if you feel super aroused for whatever reason and your partner is not interested, why not go ahead and masturbate somewhere quietly? You know, if you want to release sexual tension. So that's not. it's also why people masturbate, because they're bored, or because they feel safer that way, or because they're stressed, or because of how, well, what is it for? Yes. So if it's used only as a way to release stress, it will leave an impact. It will become eventually, it will escalate. It's like drinking. If you only drink when you're stressed, eventually you would need more drink.
Makes sense, yeah.
So it's the same with sexual responsibility.
What would be the healthy way to deal with stress, for example? Because I've switched, in my life, I switched from basically, I had a conversation with Dr. Lori Beth, and she's like, people usually masturbate a lot if they're stressed. I'm like, okay, I see what happened back then. So, but now I can see that whenever I'm stressed, I eat something sweet. I know it's wrong, but just can't help myself. But I can see it's turning into another kind of thing when it's stressed. Yeah, so...
what is stress? What is stress?
Reaction of your body or mind to some outside factors.
Yes. So it's a threat to your body. So what your brain does, what was it for? It's a survival thing. So if you're attacked by a mammal, yes, you need to be on edge. You need to, this fight, flight. You need to either run away from that, or you need to fight it. So your body showered with stress. It changes how you work. So you need to respond. Now, and it's usually to do something physical. So if people are on the phone, yes, they pace up and down.
Yeah.
Just when they're kind of stress. So people shout or they get angry. So it's a physical response. So if you buy, it depends what you like to do. You can do star jumps. So you can buy something to punch, these boxing things, or you can do sit-ups. Or I go, if it's something really difficult, I go for a really long walk very fast. I go, when I'm tired. And so you need to process, because what happens? You can only relax. Suppose you're attacked by an animal. Yeah. So you can only relax either when it's dead or when you safely ran away. But you need to do something for it. So if you sit and have a glass of wine or have a chocolate bar, you didn't do anything. You changed the balance in your brain with sugar,
okay,
right? Or with alcohol, which numbs stuff, and sugar sort of give you all this pleasure and bondage. But it's still there.
So you need the physical release.
Physical release. So in a way, shouting, crying, masturbation kind of adds to that. Yes. Okay. But doing a physical activity to deal with that particular, because you can't just say do mindfulness. You can't do mindfulness and relaxation when you're really angry. You can do it after you did something physical, but not before you do it.
All right. I always kind of had that, perhaps a silly idea in my brain that, when you're angry or when you're stressed, you just need that energy release. It is nice to punch something, maybe like a punch bag. Yeah, that's what they called. But I always thought that kind of creates a circuit in the brain that your anger punch, could that lead to something bad? Or is it because you kind of know it's a punch bag, not a person, it wouldn't necessarily escalate that way?
I don't know, I didn't think about it like that, but I don't see that unless you start punching people. Some people release their strength by punching other people. But again, everything could be taken to extreme. With punching a bag or eating chocolates, you could be a compulsive eater. That because that's how you eat chocolate. Isn't it? When you stress, you have a chocolate bar. You turn into a compulsive eater. So it's I don't know how to answer that.
Okay, makes sense.
I'm not talking about aggression. It's something I'm talking about physical outlets. And everyone is different, so you need to find what works for you. Yeah.
Makes sense, yeah.
You scream in a pillow.
If it works, it works. Interesting.
But yes, usually something physical, like dancing with the music on and jumping about.
Oh. Interesting. I never thought about it this way. Perhaps a question on somewhat different topic with regards to conditioning. That's one of the things I've been quite interested in, how people condition themselves to do things, because I think I can condition myself to do something, especially if something bad. Please, yes, it's easy. With regards to kinks and fetishes in people, Is that something that people are usually just born with and they just discover themselves that way? Or is it something they condition themselves either in a young age or later on in life?
I have no idea, to be honest. I think with people that I talk to about this sort of thing, it also depends in what time human history you live. When you live in Roman times, some things can be completely normal. You can be worried with fetish or not fetish. What is fetish? It's when you do something. Okay, so how do you understand what is a fetish?
Well,
so we have the same language.
From what I've been recently corrected, fetish is something that is absolutely necessary for you to achieve orgasm. So without it, it just won't happen. So it could be like a smell of leather or leather on your skin, and without it, it just won't happen.
All right. I don't usually, as I say, I've done some training on it. I talk to people usually who worry about certain things, that how their partner will perceive if they find out, what they like and that sort of thing.
Okay.
But your question again is why is it there? So usually people adapt to something, and with some you can clearly say which particular event led them to experience this particular need, right? And with some you can't. The extreme of it, I'm not talking about fetish, but the extreme, so when you look at sexual crimes, or people with sexual serial killers, they usually act out the same thing. Right? It could escalate or it could become more elaborate, but they will be doing exactly the same thing time and time again, and their victims would look alike, and usually, yes. And you usually can link it to some sort of trauma that individual experience, and they kind of, Freud used to call repetition compulsion, they kind of do it again and again. We all do it, but without kind of killing people, without making it so extreme and dangerous and illegal. Because people are very automatic beings, and you repeat the same thing over and over and over again. So if I ask, when people argue, the couple, it's the same argument that happens 1,000 times. It could be triggered by anything, but it's the same dynamic. So how these things, so something happens in a person's life, that smell of leather would make him feel either secure or excited, and it could be because when he or she, they were upset, and they like riding, and they were in the stable with the horses, and they smelled the leather, and it stayed in their mind as something very reassuring, pleasurable. Maybe that's why they could relax and connect to that smell.
Makes sense.
Or, as I said, with some people you will track why they find that exciting, and with some people you won't. And the thing is, it's not important if this is what they like to do, and it's not dangerous to them or others, and it's not illegal or criminal, then what's the problem with that?
Yeah, that's what I've been kind of realizing since my last conversation with another psychiatrist, that is just, as long as it doesn't harm other people, just do it. What's the problem? But I've been preoccupied because I've been reading Nietzsche a little bit of Jung as well, a touch of Freud there on there, and I'm trying to understand: is there such thing as the right way of doing things, in terms of the right kind of model for relationship, or the right way, the absolute correct way of doing things, and anything that's not quite that is not necessarily wrong, but it could be optimized to be better, so that the most optimal way of doing something, the most efficient way, kind of the best way. Is there such thing in the relationship? Like, if you have your relationships in that way, they will be the most beneficial to you, to others, to people around you, and hence it will be the best.
See, it's generalizing so much. It's with
Sorry.
No, it's okay. I'm just thinking of how to. You see, if you look at humans, most of us will have the same body parts and the same, 2 eyes, nose, but everyone is different. So pretty much like this. So Jung, Freud, and Nietzsche, they wrote hundreds of years ago. Their ideas then, some of them are still some of them are not. And a lot of disappointment come when people have a specific recipe in their mind on how relationships should happen or how sex should happen, and it doesn't match their expectation. So sex equals penetration. So kiss, touch, penetration, orgasm, that's a model of sex. It doesn't work with everyone. What if there's something happening where in a car accident and you can't have orgasm, you can't have, then what, you can't enjoy sex? Right? So if you build a relationship, there are some the unconscious, what psychodynamic and Freud use people is, there will be some messages that you received growing up, how your parents got on, or what relationships you had before, that you might not want to repeat, or you do want to repeat. You find a partner, if you didn't like your parents' relationship, it's totally different, and then eventually you find out it's pretty much the same. Or there's always some sort of disappointment when you start living with another person who's different, because you had hopes and expectations, and they didn't quite work out. Yes. So I don't know of a recipe that will work for every single human being on the planet, what it should be like in a relationship. But I don't think the education about what you want from the relationship. If you go to work, you have a contract, you have a title. Yes, so I am a relational counselor, sexual therapist. I need to come to work on time. I need to see a certain amount of clients. I need, then my job will give me a certain amount of training and all this sort of. And what happens if I break the contract? So my expectation and my responsibilities, and I get paid for that, are very clear.
Okay.
When you're in a relationship, it's also a contract, but it's invisible. You don't lay it out on a paper like that. So who contributes what to the property? Who cooks? Who cleans? How are you going to behave when you're parents? What's going to happen when you don't want to have sex at the same time? What if you like different foods? What if you like to go to different places? What is going to happen? And if it's not clear, you might not even know that you're not meeting your partner's expectation, because they don't want to hurt your feelings. So it's not clear and not discussed, and then eventually, when people just meet, they fall in hormones, and there's a lot of attraction usually, and these things, your window of tolerance to your partner's flaws is wide. But if you've been together for a long time and there is stress in life, you don't have a window of tolerance, you have a crack, everything goes in out of there. So it's what are your expectations? And we usually see people in relational counselling when there was a change, and you need to adapt to that change. So babies, or illness, or moving the country, or buying a house, or even good things, becoming grandparents, or losing your job, or retiring, all these changes you need to adapt. And your role in the relationship changes. Yes. So it's kind of talking about that. What do you need? What do your partner needs? And what are you both going to do about it? So it's a lot easier said than done.
So it's basically just a communication thing. As long as you communicate with the person on all the things and put in the work, well, it will work, because you can solve the issues because you know about them.
You want more or less same things. Yeah. Because you need to have some, I don't know, to agree, sort of to have some similarities as well on, suppose, on social level, where you come from, your education, your class, all that sort of thing. Then on, it was Dick's, he was writing about, it's called the book, very thick like that, about marital tensions. So he was doing that, how do couples fit, and values. You could be different classes, different religions, everything different. But if you have the same values in life, yes, how you want to bring up your children, where you want to live, and then you have an unconscious fetish. He usually looks at the deficits or what you didn't get when you were growing up, or what you did like growing up. So you want that in your partner, or you don't want that in your partner. So at least two of these need to work, more or less. So you want the same things from each other, or you want the same things together. Yes, because if you're with somebody and you get on really well, but the person says, I never want to have kids, and you say, I do want to have kids, what do you do about that?
Makes sense. It's so bizarre that we're not taught any of those things. It's 2:09, so you want to call it at 2:30? Is that fine? Yeah. Yeah. Just right. Just in case. With regards to people who rape is one of the things that bothers me, so to speak, because I've read somewhere an article that quite a big number of males, especially in the age period where the testosterone spikes, it's between kind of 14 and 25-ish area, they do fantasize about those things. And what's more weird is that girls also like, some of them do like a certain power imbalance and sort of idea of that happening. Not obviously it happening, but idea of sort of playing that out with their partner who they know it's, you say it stops sort of situations. Why? It's especially in woman's head, because as far as I understand, a cost of sex for a woman is much greater than that for a man, in terms of, if you get pregnant, it's a child, and it's like a whole another thing that's going on.
You're talking about maybe slightly two different things. Let me just check with you, because if people like play out rape, it's not rape, it's consensual. And fantasy is a fantasy. You can fantasize that you can either you have sex with a male or with a female, with a group of people. That's a fantasy, and you don't do anything about it. It's just a fantasy. If you have a partner who might want to do the same thing, it's not really. It's a game. Okay, so nobody is being actually raped.
Yeah.
So it's a consensual stuff. Rape is sort of violent rape. I don't know why people do it. It could be, we could hypothesize here forever, but it's taking control. It's usually like all aggression is being quite insecure about being able to attract a partner. It could be millions of reasons, but there's never justification for that. However, in many cultures, it's her fault because she wore a short skirt, or the blame goes for women even if they're being raped, and it's just awful because there isn't such and it's excused because men have testosterone spikes. This is ridiculous because say sex is not a drive. You have a testosterone spike, you can go and take care of it yourself somewhere quietly. It's not about that. It's not. You won't die if you ignore your testosterone spike. Yes, so this is something else. And this goes into forensic psychotherapy, which there is a Tavistock and Potsdam Clinic. Potsdam Clinic, there are forensic psychotherapists who work with people who act out criminal sexual acts, and they work with people who have tendency to do that, and says it is likely to be found. It's a completely different field of work. So.
Okay, makes sense.
So if it's a consensual, it is a game. You can play that one somebody's being raped, or you can play that somebody's the prince and the princess. Really, it's the same
it's
thing
a game,
because
yeah.
it is consensual. But the act itself, it's into pathology.
Maybe perhaps what could be potentially the reasons why a girl would be interested in something like that, and playing out a scenario where that sort of thing happens.
Well, we could think of maybe, I don't know, could be because you are in control of that. What is it's an abuse. If you experienced in life times where you felt out of control, like bullying at school, you had very critical parents or emotional abuse, setting it up, I'm going to be abused now, sort of play out this, but I can stop it at any time and I'm in control of that, is in a way a healing thing to do. Because you are
similar to what we discussed there, it's like you act out the consent part.
Yes, but it's what I want, not because it's forced on me.
Okay.
It's not necessarily rape or sexual abuse, but any form of abuse, emotional, physical. It could feel like it feels nice because I'm in control of that.
Wow. That's I never thought about it from that angle. So you're basically taking back the power. And what? Wow. Interesting.
If it's safe, know, if it's not safe, then it's something else. Then it goes into self-harm, and again, it's a completely different story. But if it's consensual and there's no harm, then
off you go, as they say. All right, and I think the last thing that would be interesting to discuss is about perhaps an evolution of pornography and how it could potentially corrupt one's idea of sex. So, for example, people usually start with the standard sort of sex, you have a guy and a girl and he brings a pizza, whatever it might happen, they have just a standard sex, but then you kind of watch it for a while and then you kind of get bored of that and you watch something else that turns you on and you kind of condition yourself to watch more and more. It's like with drinking, you have one drink and that's enough, then a week later one drink isn't enough anymore, so you want two. Similar with porn. Is that how that works, or is it a different mechanism?
I think it's everyone has a different kind of makeup. Why some people drink and they don't become alcoholics, and some people drink and they become alcoholics.
True.
So it's the same. Perhaps I don't know how to answer that, but there are some people who prone more to be engulfed in that, and sometimes it stays on the same thing. Another thing with porn when it becomes harmful is that it's not the porn per se, but it's searching for the right image or searching for the right type of thing that keeps people semi-aroused. Yes, and I don't ask you anymore, do you watch porn? Ask how many hours do you spend on porn, because that's what happens. And if it's a lot of time and it's actually the finding the thing, you stay in the semi-arousal aroused state. And again, this is a completely different way of being aroused than with with partners. And then it could just stay like that. But other people, they stop having enough triggers to orgasm and they want, let's say, group sex or lesbian sex or violent sex or animal sex, and then it is children's sex, because that's not enough anymore. It doesn't give them enough stimulation to orgasm. Because porn is a fetish in a way as well, that you can't have orgasm without.
Okay.
That is also could be considered a fetish.
And how do you so if what you just said, it just clicked in place there, it's not enough stimulation, so you want more. For example, in sex, and if you have sex with your girlfriend and she usually have one orgasm or maybe two, and your guys are happy, but then you kind of try something new, like maybe with a toy or something, and that gives her like 8 or 10 orgasms in a row, and it's just euphoria, so to speak, or whatever it's called. Wouldn't you in that way condition her to want more, because one orgasm is just not enough anymore, because you had one but you also had 10, and 10 is much better than one, so you want to have 10 all the time, and then you want to have more and more and more, sort of thing.
Having orgasms, a lot of orgasm is not, it doesn't necessarily mean that sex is satisfying. And again, who are these orgasms for you or for her? Yes, for you to feel good. For her to feel good. So why people have sex? Various reasons. Yes, People have sex because they want to show their love. People have sex because they're bored. People have sex because they want to get pregnant. There could be people angry or revenge or just, got drunk. There's many very reasons why people want to have sex. So it's, what do you find satisfying? I don't. Who has 10 orgasms? Where do you see that? I mean, that's quite exhausting.
Well, in my relationships with my girlfriend, for example, we can go several times in a row, and you can sometimes just lose count of how many they just happen.
Well, everybody's got differently, but as I say, it's. What was your question again?
So it's like
conditioning.
Yeah, it's like you get used to.
What is your? Yes. So if you get used to, it doesn't mean that. It depends why you have sex. If you have sex to have orgasm, or if you have sex because, I don't know, you just want to feel close to someone. So it could be different kinds of sex. One time you will have 10 orgasms, one you have one. It depends how you feel afterwards. Because you can have 10 orgasms and still feel horrible if you felt you had to do it for somebody else. Does it mean? Sort of emotionally. There is a medical disorder where people have uncontrollable orgasms. It's all horrible. Yes. It's very rare, but it does happen.
Jesus.
And it could be an indication of tumour somewhere, pressing somewhere. So it's, as I say, quantity of orgasm doesn't necessarily mean that the sex is satisfying.
Okay, understood. And we're getting close to the time. I think the last question is logical to ask would be, with psychosexual therapy, obviously they feel that you are a specialize on. When is the time to perhaps have a conversation, or do you do maybe like a free 30-minute consultation or 10-minute consultation to determine if that's something that you can help with? So that would be the two questions. So when is the right time to?
When are people to come to sexual therapy?
Yeah.
When the problem persists for at least 6 months, and they couldn't, it tried everything and nothing works. And again, what is a sexual problem? It's only a problem with desire or with arousal if it makes you feel anxious, if it impacts your relationship, then, and you don't know what to do about it, and you tried everything and nothing works, and it creates problems for your relationship, then you can come and have an assessment. Because before I suggest people actually do it, we need to understand what is this and what needs to be done. As you said, sometimes I refer people, sometimes we stay and do relationship work, sometimes we do sexual work, but we need to have a very good assessment of why is this problem there, what is the purpose of it there in the relationship.
All right. So if those kind of symptoms pop up, it's best to come and do an assessment.
And it's not 30 minutes, I usually need at least 50 minutes for a consultation.
50, yeah. Okay. All right, understood. So initial consultation, and then you see where it goes. All right, great. Thank you very much. I really appreciate you coming, and yeah, thank you.